week involving children who have recovered from COVID-19 and their risk of developing diabetes.
Let's start from the very basic question: can the disease itself cause a problem and result in diabetes? Possible. Certain theories are, as we know, the COVID infection is an inflammatory process. It's a viral infection, and viral infections can cause a rise in antibody levels. And an abnormal antibody rise can potentiate diseases like type 1 diabetes. On the other hand, could it be that the virus has a direct impact on the pancreatic cells which produce insulin? Certainly possible. But also, I think what we really need to understand, and we don't have that information yet, is could it be that the lifestyles that we had during the COVID infection ultimately led to the diabetes? Remember, we were all working from home, schools were closed, we were eating a lot more, and we know very strong association between obesity and diabetes. Could it be possible that all these children gained a lot of weight and hence they developed diabetes and made it more possible and more likely for them to be infected with COVID? Certainly possible. So the possibilities are endless here, but to say there's an association certainly between COVID-19, the lifestyle that we've had, certainly possible that there's a strong association between these conditions. I think the best advice for parents and children is that get vaccinated. The prevention is the cure. The problem is that until we understand more on how it happens, it's very difficult to advise people on what precautions you need to take. For those children or parents who have already had the COVID-19 infection, I think it's important to look out for subtle signs. The problem with diabetes is that many times the symptoms are not very obvious. But start looking. If your child starts to feel extremely tired, very thirsty, frequent urination, weight loss, certainly be aware that there are conditions, not only diabetes, but many other conditions that can be associated with COVID-19 post-infection. The reports are significant. They highlight an association. At the moment, we don't have that data within the Asian context. However, that does not mean we take it lightly. The best case scenario, there's no association, which I doubt, or there's a stronger association. Now remember all the possibilities we've highlighted, the lifestyle potential cause resulting in diabetes, the COVID infection itself resulting in diabetes. I think the mechanism is there, whatever the theory is, and it's important that, again, prevention, vaccination stays the highlight of things, and of course, there's never any harm in being more cautious and vigilant when we look after our children, and again, have a low threshold to seek a medical doctor's opinion if you're worried.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.